Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a physiotherapist talking to a patient named Jake Daniels about his back pain. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at your notes.
Hi there, come on in. You must be Mr. Daniels?
Yeah, I'm Jake Daniels.
Okay, Jake. I understand you've been having some issues with back pain. Can you tell me a little more about what's been going on?
Yeah, it's been pretty rough, honestly. It started about a month ago, and at first I thought I just slept wrong, or maybe pulled something at the gym, but it's only gotten worse. Now, it's this constant dull ache, with sharp pain when I move certain ways. It's really affecting my day-to-day.
That sounds frustrating. Is it mostly in your lower back, or are you feeling it higher up as well?
Mostly lower back. The pain sort of radiates from there down into my hips sometimes. If I sit for too long, it feels like my whole lower back locks up.
And when you say it gets worse with certain movements, what kind of movements are triggering it? Bending over? Twisting?
Definitely bending over. I have to be really careful if I'm picking something up, even if it's something light. Twisting isn't as bad, but if I do it too fast, I feel that sharp pain, like a knife in my back. And lifting anything heavy? Forget about it.
It sounds like you might be dealing with some muscle strain, possibly affecting your core and lower back muscles. Did this start after any specific event, like heavy lifting or an accident, or did it come on gradually?
Well, I've been doing some weight training, and I might have overdone it on deadlifts a few weeks back. That's when I first noticed the pain, but I figured it would go away after a few days. Instead, it's just stuck around.
That makes sense, especially if you were pushing yourself during weight training. Sometimes overloading those muscles without proper recovery can lead to inflammation or strain, and if it's not addressed, the pain can linger. Have you noticed any numbness or tingling in your legs or feet?
Actually, yeah, it's not constant, but every now and then, I'll feel a bit of tingling in my left leg, especially if I've been standing for too long. It's not super painful, but it's there.
That's something we'll need to keep an eye on. Tingling or numbness can sometimes indicate nerve involvement, like a pinched nerve or possibly a herniated disc pressing on the nerves in your lower back. It could explain the pain radiating into your hips and the occasional tingling.
Oh man, I hope it's not a herniated disc. I've heard those can take a long time to heal.
It's possible, but let's not jump to conclusions yet. Many back issues, even involving discs, can improve with the right treatment, exercise, and therapy. I'd like to start by assessing your range of motion and muscle strength, then we can work on a plan to relieve the pain and prevent it from coming back.
That sounds good. I'm ready to do whatever it takes at this point because this is getting in the way of everything. Work, sleep, even just going out with friends.
I understand. Back pain can be really disruptive, and the longer it goes untreated, the more it impacts your quality of life. What do you do for work? Does that involve a lot of sitting or physical activity?
I'm a graphic designer, so I'm at a desk most of the day. I try to take breaks and move around, but I guess I'm sitting more than I should. That's when the pain really gets to me, after a few hours in the chair.
Sitting for long periods can definitely contribute to back pain, especially if your posture isn't ideal. Desk jobs tend to put extra pressure on the lower back, especially if your workstation isn't set up to support good posture. We'll talk about some ergonomic changes you can make to reduce that strain.
Yeah, I've been meaning to look into that. My chair isn't the greatest, and I know I slouch a lot.
It's common, especially when you're focused on your work. But making a few adjustments to your chair, desk height, and how often you stand or stretch can make a big difference. We'll also work on some exercises to strengthen your core and back muscles to support better posture and reduce the strain on your lower back.
Exercises sound good. I'm just worried about making it worse. Should I still be working out right now?
That's a great question. We'll need to modify your workouts for now. Heavy lifting, especially exercises like deadlifts or squats that put pressure on your lower back, should be avoided until the pain improves. But that doesn't mean you need to stop exercising altogether. There are plenty of low-impact exercises that can actually help with back pain by improving flexibility and strengthening the muscles around your spine.
So more stretching and core work, less heavy lifting?
Exactly. Stretching, especially your hamstrings, hip flexors and lower back, can relieve some of the tightness and improve your range of motion. And focusing on core stability exercises, things like planks, bridges and bird dogs, can strengthen the muscles that support your spine, which is crucial for long-term relief.
Extract 2, questions 13 to 24. You hear a otolaryngologist talking to a patient called Mr. Johnson. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. Johnson. Please come in. I've reviewed your file, and I see we're here today to discuss the ongoing issues with your nasal congestion. How are you feeling?
Hi, thanks for seeing me. It's been frustrating. I've had this constant feeling of being blocked up for months, and I just can't seem to breathe properly through my nose. It's making it hard to sleep and focus.
That sounds difficult. Let's take some time to go through your symptoms and what might be causing them. From what you mentioned, this nasal congestion has been persistent for quite some time, correct?
Yes, it's been about 6 months now. At first, I thought it was allergies, but antihistamines didn't help much. I even tried nasal sprays, but they don't seem to make a difference either.
6 months is a long time to deal with this. You also noted on your intake form that you're experiencing a reduced sense of smell. Is that correct?
Yes, I can barely smell anything these days. It's really strange, everything feels muted, and even when I try to take a deep breath through my nose, I can't get much air in.
That can certainly be concerning. Along with congestion and the loss of smell, have you noticed any other symptoms like facial pressure, headaches or postnasal drip?
Yes, I've had a lot of pressure around my forehead and eyes. It comes and goes, but it's there most days. I also have this constant drip down the back of my throat, especially when I lie down at night.
I see. Based on the symptoms you've described, persistent nasal congestion, reduced sense of smell, facial pressure and postnasal drip, there's a strong possibility that you may have nasal polyps. Have you ever heard of them?
I've heard the term, but I'm not entirely sure what they are.
Nasal polyps are non-cancerous growths that develop in the lining of the nasal passages and sinuses. They're often associated with chronic inflammation, which could explain the persistent congestion and the pressure you've been feeling. They can vary in size and may grow large enough to obstruct airflow, which would explain why your breathing feels blocked.
Oh, wow. So they're just like little growths in my nose?
Exactly. They're soft, painless, and typically not dangerous on their own, but they can cause discomfort and make breathing difficult. The fact that you've had these symptoms for 6 months suggests that we should investigate further.
What causes them, though? Could it really be just allergies?
Allergies can be a contributing factor, but nasal polyps are usually linked to chronic inflammation of the nasal passages. Conditions like chronic sinusitis, asthma, or even aspirin sensitivity can also increase the likelihood of developing polyps. Sometimes they can occur without any clear cause.
So what do we do next? Is there a way to confirm if I have these polyps?
The next step would be to examine your nasal passages and sinuses more closely. I can perform a nasal endoscopy, which is a simple and non-invasive procedure where we use a small camera to look inside your nasal passages and check for any signs of polyps or other abnormalities. It's not painful, though it can feel a little uncomfortable.
That doesn't sound too bad. What if I do have polyps? How are they treated?
There are a few treatment options, depending on the severity of the polyps. We usually start with medications such as corticosteroid nasal sprays, which can help reduce the size of the polyps and relieve your symptoms. If that doesn't work, or if the polyps are large, we may consider oral corticosteroids for a short period.
And if the medications don't help?
If the polyps don't respond to medication, or if they're causing significant obstruction, surgery may be necessary to remove them. This is usually done through a procedure called endoscopic sinus surgery, where we use a small camera and instruments to remove the polyps and clear out the nasal passages.
Is surgery risky?
Like any procedure, there are risks, but endoscopic sinus surgery is generally safe and minimally invasive. The recovery time is usually short, and patients typically experience significant improvement in their breathing and other symptoms afterward. However, it's important to note that polyps can sometimes recur, so long-term management is key.
How can I prevent them from coming back if I do end up needing surgery?
After surgery, we usually recommend continuing with steroid nasal sprays to reduce inflammation and prevent new polyps from forming. Managing underlying conditions like allergies or asthma is also important. In some cases, biologic therapies can be used to target the underlying causes of inflammation in the nasal passages.
It sounds like it could be a long process.
It can be, but the good news is that with proper treatment and management, most people experience significant relief from their symptoms. It's important to stay on top of your treatment plan, especially if you have conditions like allergies or asthma that could trigger the polyps to return.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear 2 medical professionals talking to each other. Now read the question.
Dr. Harris. Mrs. Thompson is an 82-year-old woman who has been experiencing increasing memory loss and confusion over the past 6 months. Her daughter reports that she often forgets recent conversations and struggles with recalling names of close family members. During the initial assessment, Mrs. Thompson was oriented to person but not to time or place. Her mood appears stable, but she had difficulty with tasks that involve planning and problem-solving. Physical examination shows no motor deficits, but she appeared easily distracted.
Did she undergo any previous evaluations for cognitive function?
No, doctor, this is her first time seeking medical help for these issues. Her daughter also mentioned that her father suffered from Alzheimer's.
I see. We need a detailed cognitive assessment and possibly an MRI scan. But first, let's gather more information about her personal and family medical history before proceeding with any further tests. Natalie, please follow up with the family to get a complete history. We need to understand whether there are other factors contributing to her cognitive decline.
Now look at question 26. You hear two colleagues discussing about something. Now read the question.
To present this new program. What we are aiming to do is create a comprehensive support plan for mothers who have just given birth, focusing on their physical recovery, mental well-being, breastfeeding guidance, and essential infant care tips. We recognize that these mothers may be dealing with exhaustion, emotional changes, physical discomfort, and, in some cases, breastfeeding difficulties. Our goal is to help them navigate these challenges. I'm here today to get your feedback on 3 priority areas we have identified: promoting effective breastfeeding, managing emotional well-being, and providing infant care education. Your input is invaluable in refining these areas to better meet the needs of our patients.
Now look at question 27. You hear a conversation between a physician and a patient about managing the side effects of cancer treatment. Now, read the question.
So, Mr. Sam, you've been handling the chemotherapy fairly well so far, but now it seems the side effects are becoming more challenging.
Yes, they've tried adjusting my medication since I started radiation as well, but the nausea and fatigue are still really difficult to manage.
I see. We've tried several approaches, including anti-nausea medications and adjusting your treatment schedule to give you more rest. I want to discuss what we can do if these symptoms worsen, and how to keep you as comfortable as possible moving forward.
Okay, I've talked with my family about this, and I don't want to continue with aggressive treatments if the side effects become too overwhelming. I want to prioritize my quality of life.
I understand. So, let's make a plan.
Now look at question 28. You hear a trainee herbalist discussing herbal remedies with a senior practitioner. Now, read the question.
You've been working with herbal remedies for around 10 years now, haven't you?
Yes, that's right. Over the years, I've seen an increasing interest in natural remedies. A lot of people are looking for alternatives or supplements to conventional medicine. For instance, some patients are turning to herbs like echinacea and turmeric to boost immunity or manage inflammation. However, I still think there's a gap in understanding how these remedies interact with pharmaceutical treatments.
Yes, I've heard similar views. It's clear that certain herbs have evidence-based benefits. But the challenge is knowing which herbs are truly effective and how to safely integrate them with standard medical treatments.
Exactly. While some herbs show promise, there is still a need for more research and education. For example, many people believe in the benefits of St. John's wort for treating mild depression, but they might not realize it can interfere with other medications. Now look at question 29. You hear a trainee doctor talking to a senior. Now read the question.
Doctor, could I ask for your help with interpreting this ECG? I'm struggling to determine whether it's atrial fibrillation or another condition.
Of course. Let's go through it together. What do we see here?
Well, the ECG shows an irregular rhythm, and I'm not seeing distinct P waves. but I'm still uncertain because it doesn't seem to fit the exact pattern I was expecting for atrial fibrillation.
That's a good observation. You're correct that atrial fibrillation is characterized by an irregularly irregular rhythm, without clear P waves, but it's important to note that other arrhythmias can also present similarly. We also need to consider the presence of fibrillatory waves and the absence of a consistent atrial depolarization.
Now look at question 30. You hear a surgeon explaining pancreatic cancer. Now read the question.
My name is Dr. Lin, and I specialize in oncology with a focus on pancreatic cancer and metastasis management. Today, I want to talk to you about why attending our training on pancreatic cancer metastasis is crucial. Among all types of cancer metastases, pancreatic cancer metastases are notoriously difficult to treat and have some of the poorest survival rates. Pancreatic cancer itself is highly aggressive, and once it spreads, particularly to organs such as the liver or lungs, the outcomes tend to be far worse. Unlike cancers where metastasis has been extensively studied, like breast or colorectal cancer, the research and advancements in pancreatic cancer metastases are still evolving. At our hospital, we are at the forefront of exploring innovative treatment strategies for pancreatic cancer metastasis, particularly integrating new systemic therapies and surgical options. We've developed a specialized training program for medical teams involved in treatment planning for pancreatic cancer patients with metastatic disease. It is a valuable opportunity to learn the latest evidence-based approaches, and it is designed for teams that make critical decisions on patient care pathways.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear part of a training about interpreting chest X-rays for patients with respiratory issues. You now have 90 seconds to read questions.
Hello everyone, thank you for joining today's session on interpreting chest X-rays, particularly focusing on patients presenting with suspected pneumonia or pulmonary embolism. This training is designed for trainee R&A physicians, as you will often be the ones ordering initial imaging and interpreting results alongside radiologists. Chest X-rays are one of the most frequently used diagnostic tools in the emergency department, so understanding the basics of interpretation is crucial for effective decision-making. The topic for today is recognizing key features on chest X-rays that suggest pneumonia, pulmonary embolism, or other thoracic emergencies. We'll also discuss some proper imaging techniques and differentiate between various lung conditions. First, let's begin with pneumonia. On a chest X-ray, pneumonia often appears as a region of increased opacity, essentially, a whitish area on the film, which could represent fluid-filled alveoli. This might appear in one lobe of the lung, lobar pneumonia, or spread throughout multiple lobes, bronchopneumonia. Identifying the pattern is important for narrowing down possible causes. It's also useful to compare the left and right lungs for asymmetry, which could help in identifying unilateral consolidations commonly seen in pneumonia. When looking for pneumonia, we should also focus on any signs of air bronchograms. Air bronchograms are dark lines within an area of opacity and indicate that the surrounding alveoli are filled with fluid, which is typical in pneumonia. While interpreting these findings, make sure you assess for additional features like pleural effusion, which may suggest a complication such as empyema. Now, let's move on to pulmonary embolism. Diagnosing pulmonary embolism solely on a chest X-ray can be challenging. However, X-rays can show indirect signs that might prompt further imaging. For example, a wedge-shaped area of increased opacity near the pleura, called Hampton's hump, might be indicative of a pulmonary infarction due to embolism. Another sign to look for is oligemia, which is reduced blood flow seen in the affected part of the lung, known as Westermarck's sign. A normal chest X-ray, particularly when accompanied by acute symptoms such as chest pain and dyspnea, could also be concerning for pulmonary embolism. In cases like this, you may need to consider ordering additional imaging, like a CT pulmonary angiogram, which is the gold standard for directly visualizing emboli within the pulmonary arteries. Apart from pneumonia and pulmonary embolism, we should also be aware of other thoracic emergencies that may be apparent on chest X-rays. Pneumothorax is a good example. Look for the absence of lung markings and a visible pleural line that's detached from the chest wall, indicating air between the lung and chest wall. Prompt identification is critical, because a large or tension pneumothorax might require immediate intervention. It's also essential to evaluate the mediastinum. A widened mediastinum could be indicative of serious conditions like aortic dissection, particularly in patients presenting with chest pain. When evaluating chest X-rays, it's important to follow a systematic approach, moving from general to specific features, so that no abnormalities are missed. Always start by ensuring the image quality, rotation, inspiration, exposure, and then proceed to examine the lung fields, pleura, mediastinum, diaphragm, and bones. The decision to order a chest X-ray often depends on clinical judgment. In patients presenting with respiratory symptoms, a thorough history and physical examination help determine if imaging is necessary. Generally, a chest X-ray is warranted when there is a suspicion of conditions such as pneumonia, pneumothorax, pulmonary embolism, or other pathologies that require immediate attention. For example, if a patient presents with fever, productive cough, and pleuritic chest pain, a chest X-ray is indicated to check for pneumonia or pleural effusion. However, a chest X-ray might not always be necessary in cases of mild, uncomplicated upper respiratory symptoms. Most viral respiratory infections can be diagnosed clinically without imaging. On the other hand, if a patient presents with chest pain, shortness of breath, or signs of hypoxia, it's crucial to order an X-ray to rule out conditions like pulmonary embolism or pneumothorax.
Extract 2. Questions 37 to 42. You hear an interview with a healthcare policy expert called Dr. Samuel Parker discussing an article about the impact of health insurance policies. Now, read the questions. You now have 90 seconds to read questions.
Health insurance has become one of the most critical factors in determining whether or not patients can access necessary treatments. But how do different insurance models affect that access, and how can policy changes improve the situation? I'm Maya Cruz, and today my guest is Dr. Samuel Parker, co-author of a recent article examining the impact of health insurance policies on healthcare access and equity. Dr. Parker, thank you for joining us. Could you start by explaining how various health insurance models impact patient access to care?
Absolutely, Maya. When we talk about health insurance models, we're primarily looking at public programs like Medicare and Medicaid, private employer-based insurance, and the individual insurance market. Each of these models has its own set of rules, and those rules can either enhance or limit access to care. For example, public programs like Medicaid are designed to cover low-income populations, but they often come with limitations in terms of which providers patients can see or what treatments are covered. On the other hand, employer-based insurance usually offers more comprehensive coverage, but not everyone has access to this type of insurance, especially those in lower-wage jobs or the self-employed.
I see. So, would you say that patients with private insurance have better access to care than those with public insurance?
In many cases, yes. Patients with private insurance often have fewer barriers to accessing care. But it's not always that simple. Even with private insurance, high deductibles, co-pays, and out-of-network costs can still prevent people from seeking necessary treatments. Public insurance can sometimes be more restrictive in terms of provider networks, but it's often more affordable, which is crucial for many families. The key issue is that access to care isn't just about having insurance, it's about the type of insurance you have and the terms of that coverage.
That makes sense. Your article also talks about disparities in health insurance coverage. Could you explain how these disparities manifest and which demographic groups are most affected?
Sure. Disparities in health insurance coverage are influenced by factors like income, race, ethnicity, and geographic location. For instance, minority populations, particularly Black and Hispanic individuals, are more likely to be uninsured or underinsured compared to their white counterparts. This is largely due to systemic issues like income inequality and employment patterns. Many minorities work in jobs that don't offer employer-sponsored health insurance, and they may not qualify for Medicaid or other public programs due to varying state eligibility requirements. The result is that these groups often face significant barriers to accessing necessary care, exacerbating health disparities.
So you're saying that these disparities in coverage lead to worse health outcomes for certain groups?
Exactly. When people can't afford or don't have access to health insurance, they are more likely to delay or forego treatment, leading to worse outcomes over time. This is particularly evident in chronic conditions like diabetes, heart disease, and hypertension, which disproportionately affect minority populations. Without consistent access to care, these conditions often go unmanaged, leading to more severe health complications and higher mortality rates.
What policy changes do you think could improve access to care, particularly for underserved populations?
There are few potential policy changes that could make a significant difference. Expanding Medicaid eligibility in all states would be a good start. Currently, several states haven't adopted Medicaid expansion under the Affordable Care Act, which leaves millions of people without coverage. Another important change would be to introduce caps on out-of-pocket costs for private insurance plans, making care more affordable for those with high deductible plans. Additionally, we need policies that incentivize providers to offer more services in underserved areas, particularly rural regions where access to care is often limited.
Interesting. What about the role of the government versus the private sector? How do you see that balance affecting healthcare access in the future?
I think there's room for both the government and the private sector to contribute to improving access to care. The government can play a significant role in ensuring that basic healthcare services are accessible to all through public programs and regulation. At the same time, the private sector can drive innovation in care delivery models, like telehealth, which has the potential to expand access, particularly in rural and underserved areas. The challenge is finding the right balance between regulation and innovation, so we can address the gaps in the current system without stifling the development of new solutions.
That's a great point. Could you expand on how telehealth might change the landscape of healthcare access in the future?
Telehealth is already making a big impact, especially during the COVID-19 pandemic, where we saw a dramatic increase in its use. By allowing patients to connect with providers remotely, telehealth can overcome barriers like transportation, time off work, or the distance to the nearest healthcare facility. This is particularly beneficial for rural communities, where there might not be a local specialist available. However, for telehealth to truly be transformative, we need to ensure that everyone has access to the necessary technology and broadband internet, which is currently a barrier for some low-income and rural populations.
It sounds like telehealth has a lot of potential, but also some challenges. What steps could be taken to make telehealth more accessible to all patients?
One of the key steps is expanding broadband access to rural and underserved areas. Without a reliable internet connection, telehealth is simply not an option. Additionally, healthcare providers need to be incentivized to offer telehealth services, and insurance companies should provide comprehensive coverage for these services, including reimbursement at parity with in-person visits. Education is also crucial. Patients need to be aware that telehealth is a viable option and feel comfortable using it.
That's a lot of food for thought. Thank you, Dr. Parker, for your insights on this critical issue. It's clear that improving access to healthcare requires a multifaceted approach that addresses both policy and technology.
That is the end of Part C. You now have 2 minutes to check your answers.